Magnus and Bobby said they're looking for somebody who feels old and tired in their joints. Anyone old and tired? All right. What's your name? Cindy. Okay, we've got Cindy. What's going on with you, Cindy?
Left hip pain mainly, and then just generally feeling tired. Yeah.
I like how she left out the old. I like your attitude. All right, Magnus and Bobby, go for it.
Thank you. So we're structural integrators, and we work with fascia. I don't know if I actually said that, Amanda. Did we say that? Old and tired? I did.
I did. She said, who do you want for the demo for this? And then we were talking about Gait. So I'm like, who's feeling old and tired? Like, I don't want to walk. It's hard to walk.
Do you have any issues with walking? Yeah. Do you mind taking your shoes off?
Would we be able to watch her walk?
Yeah, I was just thinking about that.
Should that just be right here on this stage or, okay. So maybe you could. One thing I'm noticing is she's walking very heavy.
Yeah, it's definitely a heel strike, especially on the right one. I don't know if you pick up on that.
How does that feel to you, your walk? What do you notice in your body as you walk? She feels wobbly, maybe?
Yeah.
Wobbly. The surface is not smooth.
Yeah.
Well, do you want to walk down there? I want to know how you feel when you walk. Are you putting more weight on your left? Is that what you're saying? Okay. That's what it looks like.
So then we want to look at your posture. So maybe come up here on stage and face the audience, and I'll walk down here. I don't know if that's okay with the camera. Yeah. All right. So now what we like to do is just look at the overall alignment. You know, instead of going like, well, the pain is here. Well, we want to see what does the structure tell us? You know, what are the joints tell us? The fascia, where's the fascial tightness? So if I'm looking at her feet, and you already pointed out the bunion, it looks like the right one is slightly worse, possibly than the left, but they're both the big toes are going inwards. And in our world, this is like a medial tilt on your ankles. So that would be like an overpronation that we're seeing, right? And generally with an overpronation, we're going to have some shortness on the outside. We're going to have tightness coming up in the outsides of your hips. But you might also feel a pull like in the upper groin area. Might feel some tightness. I don't know if that strikes a bell. Okay. And we're not working shoulders now, but I'm also looking at the positioning of her arms. It's also something we're looking at. So her hands are going in front of her body. So arms are doing this type of alignment. So that could be some tightness from the front. Could be pectorals. Could even be, go ahead and raise your arms straight up. As high as you can. Okay, so it's a little bit of tightness in the latissimus dorsi. And bring it down.
Hold on a second. Do you guys see that right side, the difference? Go ahead and start rolling.
Do it again. Yeah, definitely. So the latissimus dorsi, and if you turn your back. So latissimus dorsi, of course, goes into thoracolumbar fascia. So tightness in the lats, but even pectorals. When there's tightness in the pectorals, it tends to pull the shoulder girdle forward, right? So now we have a roundness in the low back, and we know we need to have a nice lumbar curvature. So there's definitely some tightness going on in the shoulders here that could affect the pelvis. So we're looking at the pelvis, but also how does the shoulder girdle affect the pelvis? How does the arches affect the pelvis as well? So can you point to where you're feeling pain, just so we know? It's more on the left side. Okay. Can you do like just an easy side bend? Okay, so that's going left and then go right. Okay, what does it feel like to you? No. Yeah.
She also did like a little compensation with her left shoulder when she went right.
Yeah. So is there any type of pain when you're doing that? Any type of pain though? There's just tightness. Yeah, I see it there on the left. Okay, so now turn sideways. So let's see your left side.
Like when she speaks, tell them what.
Yeah. Say that again. What you're saying? Yeah, so she feels pinch on the left side, but not so much pain, but just a tightness pinch. Okay, so now anyway, you could you pull your shirt up just a little bit so we see the pelvis, kind of tuck it in maybe. Okay, because we also, when we're talking about gait and improving gait, we also want to check the angle of the pelvis. Can you, a little more on the front maybe? Yeah, so we can see. Yeah, oh, that's good, yeah. So we're looking at the pelvis as a bowl. And in her alignment here, it actually looks like you got a little bit of a posterior tilt. So the tilt we're talking about is can I put my hands on your back? So looking for the PSIs in the back. If you think of the pelvis, my thumbs are the PSIs in the back of the pelvis, and my top finger here is the ASIs. Okay, so we're looking at the angle. For females, should be maybe 5 to 15 anterior pelvic tilt. For males, maybe about 5 degrees pelvic tilt. Now, it looks a little short in the backside. We're going to check your hamstrings as well. But I can see the tightness going in the hamstrings. I don't see a lot of the calcaneal bone in her foot. So that definitely could play into what's going on. Let's see the other side as well. Yeah, that might even be that could be an anterior pelvic tilt actually on that side. It looks quite different. So let's get you on the table. Let's lay on your back. And scoot down towards me just a little bit. Okay, good. So I'll get started here and then Bobby will jump in. So checking the leg length. It's always a good thing. Looks like the right leg is actually a little bit shorter, measuring from the medial malleolus or even the heels here, if I'm pulling. I can also feel the weight of the legs. You know, it's not a good way. So right one feels a little bit heavier. So here's another assessment technique that we do. This is a rocking technique. And she's actually moving pretty well in the knee. We can also do a little bit of a compression, decompression. That hip feels tight. And I can continue working on different planes here. Is that okay for you? No discomfort? When I'm doing this, yeah. Okay, and now we'll check the left side. We're doing the rocking. Now this knee feels like it's moving inwards, it's moving medial. So there's a different feel to it than the right leg. And I'm gonna press in. Now that hip is moving a little bit better. And there's no pain when I'm doing this.
And this is the left leg, so the one that she relies more on the more she was walking on.
Doing this in different planes. Now we also want to check, there's no sciatic pain. No sciatic pain going on? No, she don't have any sciatic pain. And very good flexibility in the hamstrings actually, way beyond 90. So go ahead and bend the knee. So now we can check internal hip rotation, should be like 30, 40 degrees. And I would say she's in range for that, maybe a little tight. End range feels good, feels bouncy. And then I'm checking external. Now you're tight external on this side, you feel that? So she's lacking maybe just 10, 15 degrees, but it's enough. Definitely feel like it's not moving like it should. Coming back, rocking a little bit. Can also do another rocking technique where I'm just grabbing the foot and leaning back. Now we can even move all the way up to her head. Does that one feel okay?
Do you feel this in your back at all? Like in your lumbar spine?
Okay. So obviously if there's, disc issues going on, there's not something I would do.
But at the same time, if there's general tightness going on, this is like, oh my gosh, if you just rock and shake the leg,
Yeah.
some things get to open up in the back.
So we'll check this side. This one's tighter. You feel that? She has 90, which is great, but there's tightness behind the knee. Do you feel that as well? And definitely doesn't move as well as the right side. So bend the knee. Now she has great internal on this one. 40, 45 degrees. I mean, she's definitely there. Not a problem. So compared with the right leg's actually more limited internal rotation, even though that was close to norm. And she's tight external. So now you feel that as well, right? We're seeing that she's also tight external rotation here. Not bad. Let's say the right side was a little worse. Coming back. Rocking here again. And little traction. And some rocking. That feels okay as well.
And we can ask her to breathe, take some nice deep breaths with this, encourage her to just let go. A muscle and joints stretch best when they're relaxed.
And some rocking that actually feels so what I'm feeling for here might be difficult to see, but I'm feeling is there a connection between the ankle joint, knee joint, and hip joint? This is moving better now than when we started. And you feel that too? Yeah, she feels that as well. When we started, this left knee was moving inwards, just with a simple rocking technique like this. And I'll come back. This one it's moving well, not a problem. So I know with her feet going into overpronation, which we call a medial tilt of the ankle, I want to do a little bit of work. I'm going to start on this left side, because that's the side I want to affect the most. So my hand's going under the hamstring, and this is a push and pull technique. So now I'm pulling with my left hand, and normally we do this on the skin, but it works through clothes as well. And now I push. So this is what Adolf used to call the long roll. And even the foot's gonna turn when we're doing this. So I'm just staying with it. You feel a little bit of a rotation. And Bobby's showing with the hands. So I'm staying with this. Now I'm gonna go up a little bit on the hamstring here, about the middle. And I'm gonna pull. You can see when I'm pulling, the leg's moving, but I also wanna have a push. So I'm going vastus lateralis, and here's the push, and I'm even bringing my body over. So we're starting to scoop the tissue here. We talk about scooping fascia, of sinking into it and moving it. So we work without lotion. It's dry work. And that's starting to get a little tight up here.
Where exactly are you feeling this in your hip? Is that the area that you were saying was bothering you when you did your side bend? So if we're talking about tension and pulling.
And I'm gonna do one hand position just a little bit higher. And I'm gonna pull, and I'm gonna sink in, and I'm gonna lift it. I'm gonna push.
Notice how he's lifting his body when he did that.
And also look at her foot. I can turn the positioning of her foot with this move here. So now it's harder to do through clothing, but we're still getting a fascial release.
Good deep breath. Nice.
And I can focus my attention on now coming down towards the foot. So I want to see, can I move the tibialis anterior? Can I move this up a little bit? Can I move that tibialis anterior fascia? So now I'm lifting it You can see her foot's turning even more. So we're rotating the whole leg.
Can you say where you feel this?
So I'm lifting like so.
Once he goes into it.
Yeah. And eventually,
So she said the same area.
eventually we're going to do some prone techniques as well. But we like to start out on the front side. Generally, there's more tightness, shortness in the front body. So I'm just lifting this tissue. What does this feel like on the spot? Do you feel any stretch here? Yeah. Okay, she feels the rotation. So let me get in a little deeper. Do you feel that one? Okay. So this tissue feels very dense and stuck. So there might not be a lot of sensation going on down here. So there's 4 compartments in the lower leg, and I'm working in towards the tibialis anterior, towards the tibia. So that's one of them. So we're going to show all 4 compartments. This is the first one. Now, we're also going to check dorsiflexion of the ankle. So bring the foot in. Okay. She has dorsiflexion. Now bring it out. That's plantar flexion. And we're also going to check inversion and eversion. Definitely has eversion, which we have more of. It's a little tight on the inside of the ankle. So now we're going to go in with some traditional fascial work. So I want you to move the foot in towards the knee. Yeah, like that. Just hold it like that. So now I'm sinking in. And now point the foot. Like plantar flexion. Now slowly bring it back. So on a level from 1 to 10, with 10 being too much, 1 being nothing, where would this be? Okay, so we aim for 7. That's our therapy zone. 6 or 7. 8, borderline. 9 and 10, definitely too much. Good. So now I also want to work the top of the foot, and we've been noticing the big toes, and we might not going to have enough time to really change the positioning. We'll see if we can change the feel. So now bring the foot in. Yeah, like that. And I'm working on the top of the foot. And I'm working up towards the front of the ankle. So now point, plantar flex. There we go. So now I'm scooping. I'm lifting this tissue. And I can continue up on the foot. So go ahead and bring the foot in again. And plantar flex. So I hook in or press in. Here's the scoop. Notice my elbows.
Yeah, notice Magnus's stance with his arms. They're out, they're not in. They're away from the body. We're using the lats. We're using our legs, and we're leaning forward with our body.
So what level is this from 1 to 10? Okay. So we're getting into it here. So this, and bring the foot in again. So this is not totally comfortable. We like to add some movement. And back out. Good. So we got some movement here. Good. And bring the foot back up again. So I'm working up towards the knee. Working inside, outside of the tibia. And plantar flex. Yeah, keep going. Good. So now, I also want to affect gastrocnemius. So, Bobby, you want to show what I'm doing here?
Yeah.
So I'm bringing, there's 2 gastroc heads. I'm coming right in between, So now I can also stretch if I want to use both hands. So I'm pulling away from the knee. I'm right in between the two gastrocats. Okay, so let me slow down a little bit.
And it's a pull away, not just with the fingertips. It's a hooking into the tissue and
So-
bringing.
I want to create space between the two gastrocats before we get to the Achilles tendon. Okay, how about now? Okay, so we're getting, it's definitely tight back here.
And she just activated her breath all on her own. Good job.
Good. So now I want to do something, and we have a lot of different techniques we use, but obviously we're limited on time here. So now go ahead and spread your toes. So now we're working the bottom part of the foot. The scoop is somewhat different because now I'm going into the floor here. I'm going downwards. I'm not lifting up. Yeah, so keep spreading those toes. That's all right.
So he's asked her to spread her toes open, and she's having difficulty actually having that experience. So it's the effort that counts. It's the trying that engages her tissue, that creates a little tension for him to dig into.
Working the bottom part of the foot. Can you feel the stretch on the bottom part of the foot? She can feel it, yeah. So that's important because she was heel striking, right? So when you get some tension on the bottom part. All right, now turn on your left side. And we're gonna bring this knee over. So bring the right knee over. And now, that's a nice dorsiflexion right there. Now, in this position, you're comfortable like that? Now I can work in to the outside of the foot. So again, using fingertip pressure. So can we add some movement here? Yeah, so find the movement. There you go. That's it. So she goes into dorsiflexion and go slow. Yeah, go real slow. And then dorsiflexion again. There we go. Good. And I can continue. Same arm, same leg as far as body mechanics. Slowly go ahead and reach out through the heel. So this line can be sensitive. So I'm pressing down, now I'm scooping. And keep moving, yeah. What level are we on here? Okay, good. It is tight in here. And now we're talking about, okay, 7, okay.
So the higher we go, the higher the number goes, the higher we go up the leg.
So we do have tibialis posterior back here, edge of the calf muscle, gastrocnemius. We bend the knee, we can even get into soleus. So how about if I get into the arch of the foot here? So go ahead and lift your toes up a little bit. Talk about improving toe flexibility. So I can reach into the medial longitudinal arch. And with fascia, we work in all directions. So I'm working across the foot now. Good. So now turn over and do the other side. And bring this knee up. No, opposite. Yeah. This knee. Sorry. So we got to find a way of getting into the lateral longitudinal arch, the outside of the foot. And bring your toes up just a little. Yeah. A little bit dorsiflexion here. And I'm working the outside of the foot. Could even use my thumbs here. Of course, you don't want to overuse your thumbs. I could switch to some knuckles. Yeah, small movements. So now we're getting into peroneus grip. And that's tight.
So if you can see, since you're here, his back leg is lifted from at the heel. So he's using that to bring his direction forward. And also the movement is helping pull him forward.
Now,
So it's not just pushing, it's a hook in, ask for some movement,
level.
and then
What level is that? Okay, about a 5. So can we do forearm? Sure could. That is tight here. So small movements like reach out through your heel. Not so much with the toes, the heel. Yeah.
and so as she moves, she's tightening and she's loosening the tissue. And each time that brings him forward and forward and forward. So it's not about crushing it and trying to make it happen. It's about, okay, she moves and now I can move. I go with her. The tissue pulls me through.
So we do want to even this out. We have time to do a little bit on this side with some sacral techniques. But do you think you can get up on this one? To see how it feels? The first we're just going to stand her up and see how that changed. You can face the audience, it's good. So bring your knees over your toes. Good. And back up. Any sensation from what we just did? Yeah. Yeah. So if you look at the foot, there's less overpronation going on. If you look at the right foot, we still have a medial tilt. Still medial tilted, and we can call that an overpronation, right? So the left one is a little more grounded. What I'm looking at is ankle, knee, hip. And also if you bring your knees over your toes, should feel a little, and it comes a little further on this side. Do you feel that? So that is, it should be a little easier. So let's do the walk again, just kind of gently. Can you tell a difference in the walk? Yeah, same. Yeah. Yeah, it looks like the foot is a little more supple as she's going through. Maybe you can push with the big toe more on the left. Yeah, you feel that. She said she does feel that. So, Bobby, you want to do the other side?
I honestly didn't want to do the other side. I want to do something different. Can I look at you? Okay, so that's really amazing. Your right arm is not doing the exact same thing it was doing before. Like your scapula has actually come back. So could you do that arm range that you did earlier?
And then maybe face the audience as well. So we do the same thing. So bring it down and come up again.
Okay, so I have, I'll say hello to that leg.
Yeah.
And then I'm going to do a little something I want to see on your side, the correlation to this whole left leg situation. All right, so lay face up for me. And just start your breath work. So this is me saying hello and sort of skipping over a lot of stuff, but saying hello so I can get to something else that I want to do. I'm just going to run through. I can feel the back of her knee is really tight. And the front of her leg is really tight. So I'm just feeling all the tension. Doing some joint range of motion. Just wanting to soften that a little bit. This is pretty tight in here. So I'm just going to hold this stretch for a minute and then ask her to breathe. And I'm doing a little rotation with the hip so I can find where I really want to get into this. And she says,
So go ahead.
So because she has pants on, I'm not going to effort in a way that I would if she didn't have the pants on. So I'm hooking in to this area that I can feel is tight. And I'm just creating a little movement so that I can stay still and I don't have to force my shoulders to do anything. But as I move her, we're getting some change.
So the supine hamstring technique can be done with right on the skin as well as the way we normally do it. And then you're going to see a little more of a glide than you're seeing now. But this works very well as well.
Just stretching everything. So I hope you can see how nice and tall I am, but I'm in a downward position. And you can just relax that leg. I'll take it from you. So if I were in my office, I would say, come a little closer to me. Put yourself over to the edge. And I'm trying to get in. Oh, already this feels a whole lot better. Can you feel that? Yay. I love it when they feel it. Oh. So that one little spot, but there's also one on this other side. So I'm doing the same idea. Just hooking in, downward pressure, putting her in a bit of a stretch.
So there is a direction of the way her fist is right now. So she's not just pressing in, she's pressing in, but then she's moving in this direction. So she's scooping the tissue down towards the floor. That's with movement, that's what we're looking for. So when you're working through material, you're not going to see that movement like you would on the skin. It's going to be shorter and more in segments.
Now let's check that. Ooh, look at there. She feels it, but I can do it. Is that all right? I'm not going overboard? Am I going beyond your limit? How about that? Now take a deep breath. Nice. Okay.
So we started getting some dorsiflexion with the hip flexion, which gives you a truer measure on the tightness on the back fascial line.
And this feels really good. So I just want to address the top of her foot. So I'm just going to place, I know I'm going to be here for just a moment. So I'm just placing my thumbs. I'm using my body to give her a little dorsiflexion, placing, scooping, leaning into it. And I'm moving with gravity through the tissue with the movement and the lean and the scoop. And things are opening up very nicely.
How are we doing on time, you guys?
We're at 15 more minutes.
15? Okay.
So now I'll just do I'm doing two things here. I want to have an influence on this back side, so I'm going to grab, put her in dorsiflexion.
And she's pulling with the hand on the bottom. So there's a little bit of a fascial release going on in that Achilles tendon and even the gastroc area now.
That feels pretty good to me. I'm happy with that. I would do the bottom, but just to say hello. Sorry about that. Okay, so here it is.
I think that was a 10.
Yeah, that was a 10. And I'll be honest with you, I don't mind getting a 10 at the first because I know where we stand. I know what not to do anymore, but now I can go in a little more cautiously, hook in, and then just use a downward pressure. So it's like this, hook, and then I lower with my legs, as opposed to trying to make it happen. Put her in a position of stretch, soften up so that I can hook, and then use my legs to scoop down.
So there is an intent with what we're doing. She's pressing in. The intent is moving downwards, so that's a scoop, right? But it's not a force. She doesn't force it to open. She's not going to go anywhere unless the tissue, the fascia is ready to open. That's what we're looking for. So you got to be soft in your hands when you're doing this type of work.
And this is really, really tight, and it's not a smooth move. I'm sort of skipping like that, but that's okay. We made a difference. Yay, you're getting ready for dance. Okay, so I wanted to do, this was the side that was bothering her, and then this shoulder is affected. So this cross body situation that's going on, I want to address this and see what I'm going to at least investigate. So would you be able to turn this way and let me work your side? Do you mind if I work over your undershirt and get on your skin? Yeah. Okay, so I'm gonna let you pull that up. Just loosen it out of your pants on this side. Okay, perfect. So this is the area that I'm gonna be working around serratus anterior. And she's closed off and that closes her side. So I want to expose her side. So I'm gonna first put her hand here and see if that helps, and it really doesn't. So I'm gonna have, are you comfortable? Are you okay like that for a few minutes? Okay. So this gives me a side to work with. If her arm is forward, it's gonna cause me to work more posterior. So if I put her arm in this position, this is the area I wanna work, in this little rectangle. But I'm gonna start from her rib cage on the front. Let's just say right around here. That's where I'm gonna place my fingertips. So I've scooped in. I'm gonna balance her and hold her and let her know, hey, don't roll backwards. So I'm in my legs and I'm leaning with my fingers. I'm not pushing my hand. What number is this on comfort? A 5 or a 6. Okay.
Can we hold is it okay to hold the shirt up a little bit so we can see? So I can hold it, yeah, like there.
So I want to round over to the side. The fascial belt around that under bra area. We're addressing that. And so she started to, as I got on the side, she started to roll back. So I can sort of grab her in a nice fascial way, hook into that tissue in the back. And
so the fingertip pressure, Bobby's actually pressing in and then scooping. So it's press, but then this happens.
so I want to go a little more directly, less at an angle, just a little more towards that inferior angle of the scapula.
What level is that on pressure? Okay, so she's getting in there. It's not like easy. She can actually feel this pressure.
So I'm going to use my body to get, because I feel like I'm not really getting anywhere now. She's loosened up enough to where I'm hooked in really good. And I think I'll also ask her for movement. So as your hand is there and your elbow is up to the ceiling, bring your elbow towards where I'm at. Now I can hook in a little bit better. And now just stretch your arm out straight a little and come back. You don't have to go all the way straight and come back. Now I'm traveling.
So very often we ask for active movement as well. Helps with proprioception.
That's really good. That's so much better. Keep bending and straightening. Good. And you can put your arm down. So that's what I wanted to do in that area.
Posterior.
I was going to do the
From-
other side around the
Oh,
hip. Is that
sorry.
okay? Okay, so do you mind facing the other way? Let's see what's going on here. Oh, that's nice and tight, but not around the ilium. So I always get in my legs. This is way tighter. So my fingertips.
You can see it easier on the side, perhaps.
And tell you what, since she likes to roll backwards, I'm going to bend her up some more. Bend your knees up some more this way. And then I'm going to take her legs in line with her knees. So we got straight lines here. That will help. You can get more right there. Perfect. So this upper body is really tight. Okay, this is very outstretched. So I'm gonna have her bring her elbow back in. Bring it in some more. There you go. And let's have you straighten your elbow your hand to the ceiling. And then take your arm behind you a little bit. Okay, there we go. That's the angle. And now bring your arm forward and back. And maybe do some rotations like towards your ear. Yeah, and come back. Yeah, little ones like that. So I'm just hooked in and staying. And this movement is bringing me forward through the tissue.
And notice the push and pull as well. Her right arm is pulling, her left hand is to push. It's to play between these two hands. Addressing the rotational pattern.
So I found myself right under that bra line. Now I'm finally getting on the side and heading towards the axillary border of the scapula. What are you feeling? It feels locked in, doesn't it? So she said it feels tight, definitely. So I'll do one more like this. Tell you what, take your arm now over your head and come back. Nice and straight.
So there is a play between your rib cage, your shoulder girdle, and your pelvis. Obviously, for movement, there has to be movement in the shoulder girdle as well. So that's why Bobby's doing some work on this upper part.
So now this is opened up a little bit. So I'm gonna address some tension that is right here that I was feeling because she was moving. I could tell where it was coming from. And so it's going to be passive. So I'm going to ask her to relax. Compression and then a little movement. So a little hook.
So 5 minutes left, Bob.
Okay,
Do you want to do prone as well before we end up? And we want to see the gait again.
So I would probably do more, and have her move that. So I would come posterior and she would move her arm forward and stretch things out and continue along that line. We could address the neck on this side. We could address what's going on these bones that's related to all of this. Okay, so do you want to do a seated?
No, let's do prone and just loosen up the sacrum a little bit and then have her walk.
Okay. Does this have a headrest or are we just having her?
Yeah, are you okay laying face down? Maybe turn the head to the side.
Or however you feel like you can be comfortable.
So then checking the legs again, it looks a lot more even at this point. We haven't checked her quad flexibility. There's a little bit of tightness there as well. We can check external, internal hip rotation, which looks a lot better than when we started. Definitely some tightness in the quadricep. Checking ankle flexibility, starting to feel a little bit better as well. There's a lot of techniques that can be done from this position. We don't have time to get in all that, but I can work everything from this position as well. And we'll check our quad. We check our external rotation. Now that's still a little tight on this right side, so you can see that. So as we're coming in here, she's not quite in range. She's lacking like 10-15 degrees. So is that something I possibly can improve a little bit? Is the pressure okay? You guys can see.
You were better the other way, I think.
Better the other way? Yeah. So just some simple compression techniques. I'm moving the fascia laterally, working around the greater trochanter. And anytime working around the greater trochanter can get a lot of relief. How's that pressure, ma'am? Good.
This is similar to what I was doing with the hamstring, hooking in, creating a stretch.
So it's not just a compression, it's a compression and a hook. So we're not working on the skin, but that's how we still can get this fascia to move here, and it's already getting better. Does that feel okay? Yeah. Yeah, we do. So
Let me do this. We'll do
Yeah,
tandem.
that's already
We're gonna do
starting to-
tandem.
Starting to loosen up. Yeah, so that's a little better. I don't know if you can see that, but we got about 10 degrees or so. So take your time.
1 second.
Yeah, that's good. I think Mark wants you to do the gait. So come on up.
Take your time.
Yeah, make sure you're not dizzy. That's good. So let's come back on the floor there and do the runway walk again. It's definitely a softer walk. I don't hear or see as much clung. So she's shifting the weight from just the heel. There's still a heel strike, but it's softer than it was before. And of course, we are going to have a heel strike, but we don't want the heel strike to be back towards the calcaneal end of the calcaneal bone. We need a little more under the foot.
Do you want to come center and raise your arms up, like face that way? Let me see what that looks like.
Yeah,
Nice.
better. So all the work that was done on the rib cage serratus, plays in with the gait as well. And this, very short, but hopefully we got some improvement for you.
Do you want to say anything?
Yeah, go ahead. Go ahead and give her that.
Just feel a little lighter for sure. Like the twist it feels like it's not as twisted within that hip region.
Yeah. Thank you. Good.
All right, thank you.
Thank you, everyone.
And